start with the majority or the minority here?
Let's give Chris a shot.
Chris a chance to start.
Yeah.
So let's start with you, Representative Turner. So the question is, in the last session, there were some things that were done, some things maybe that were aspirations that weren't achieved. Can you talk a little bit about the last session, where you ended up, and what are your priorities going forward?
Sure. Well, Vern, first of all, thank you for the opportunity to be here. It's great to be here with you, with Chairman Frank, and good afternoon to everybody here. It's great to be out doing things in person again, so it's great to see everybody.
I'm sorry, you're on mute.
Am I on mute?
Can you unmute? No, I'm just kidding.
No.
I'm just kidding.
Right.
It is great to be back.
I was going to say, I thought I could. Yeah, it is. Yeah.
Right.
Yes.
Yeah.
No, I know. I think we're all tired of hearing that. Last session, where to start? It was an eventful session. Just to cherry pick a few kind of maybe highlights and lowlights from my perspective. I think, we obviously came into last session in January of 2021 at the height of the pandemic. So the vaccines had just begun rolling out, but were hard to come by at the beginning of the session. It was when we were in the middle of really one of the worst surges of the COVID-19 pandemic, and I don't have to tell this group that. Everyone here works in healthcare, but it certainly affected the session overall, just in terms of how legislators could interact with one another and how we conducted our business in the Capitol. So initially, we thought the session would be very focused on response to the pandemic, and then we sort of went through this cascading series of crises between the pandemic and then the grid failure and the storm recovery and a variety of other issues. But specific to healthcare, a couple things that I'd point out that I think were significant from last session. One, on the positive side, and I'll speak from the Democratic Caucus perspective in terms of some of our priorities that our members worked on, several members who are here today. I saw Representative Goodwin and Representative Howard, and I believe there are some other members on their way. For instance, one of the key healthcare priorities we wanted to address is the Medicaid coverage for new moms. And right now, or prior to last session, new mothers on Medicaid would lose their coverage at the 60-day mark postpartum. And Representative Tony Rose from Dallas carried legislation to extend that Medicaid coverage to 12 months, which is what most states do. Now, the House passed that through Chairman Frank's committee. And the Senate had a different perspective on it, unfortunately, from my vantage point. But in compromise fashion, the legislature enacted a 6-month extension or 6-month coverage, I should say, for new moms. And so that was a key win. It wasn't everything we wanted, but it was certainly progress in the right direction. Somewhat similarly, we had an effort that was led by Representative Phil Cortez from San Antonio to bring some improvements about in coverage for children in Medicaid and CHIP with respect to eligibility checks and the way some of those kids fall off the rolls at different parts of the process. That made progress in the House. The Senate didn't agree with us on that. And so that's some, I think, some low-hanging fruit that is still out there to tackle. Obviously, from a Democratic Caucus perspective, this is not news to anybody in here. Our top healthcare priority is for Texas to join with 38 other states and expand Medicaid under the Affordable Care Act, which would bring insurance to more than 1 million Texans, most likely, who fall in that coverage gap where they don't qualify for traditional Medicaid, but don't qualify for the tax credits in the marketplace. And as we have done every session for the last several sessions, We proposed an amendment in the appropriations process and the budget process on the House floor to authorize and require state government to pursue that expansion of Medicaid. Unfortunately, and that effort was led by Chairman Garnet Coleman, who, as you all know, recently retired from the legislature. But that measure fell short on a party line vote, or nearly a party line vote, I should say. So those are some of the kind of key healthcare measures that come to mind immediately, thinking about last session, and some of the things that I think we'll continue to work on going forward.
Yeah, thank you.
Yeah,
Representative
so from thank you very much. Good to be here, and great to be with Chairman Turner. And I think we really did focus quite a bit on healthcare last session. Obviously, there were a lot of other things going on, but I think in addition to the bills that he talked about, which while the 290 didn't pass the Cortez bill, it did end up passing on amendment in the House, and so it is in law. So we got that priority across the line to try to improve the efficiency and make sure that kids are not getting dropped off inappropriately off of the Medicaid rolls, because I think it's just important to run those programs as well as we can where it makes sense to have them. But we also focused on a number of things. We have a number of places in the state that don't have insurance competition. There's 40 counties that have one place to get an Obamacare policy, affordable care policy. But I don't know, I guess either one's fine, right? That's okay.
President Obama said it's okay to call it Obamacare.
Okay,
so
good.
I think you're okay. I think you're
I
okay.
I really wasn't trying to be disrespectful on that. But there's only literally 40 counties that only have one place. So we actually stood up Texas Mutual and Farm Bureau to try to add more competition in places that lack competition, because healthcare costs is a huge thing. That was done really. We're obviously in the House. I think the House took and the Speaker's office took a good lead on healthcare. The two policy priorities that Chairman Turner was talking about was in our Healthy Families, Healthy Texas plan, but also included a lot of other things, including broadband, because broadband, particularly in rural areas, is tremendously important for healthcare. A lot of people can get their healthcare much quicker. The idea that you have to go to the doctor, you have to wait 30 minutes. If you really just need a 5-minute conversation, healthcare is an important issue, and it can be delivered that way very effectively. And so there was a lot of things we did on that. So really, there was a number of, Representative Howard had a bill in there. It was a pretty broad coalition of bills, and I think one of the things we tend to do is spend all our time talking about whatever we disagree on. Meanwhile, we passed, I think, 7 of those 10 priority bills with pretty good bipartisan support that hopefully made things better for Texans. And yet we tend to spend all of our time talking about whatever it is that we didn't agree on.
Yeah. Any response?
Well, I agree that there is a lot of focus. I think it's just the nature of politics.
Oh, absolutely.
And
I'm not saying it was you. I'm just saying we, the media, it's just more fun to fuss and talk about what we don't agree on.
I think the same is true at the federal level. A lot of, believe it or not, a lot of what Congress does, just like a lot of what the state legislature does, is accomplished on a bipartisan basis. But the attention is focused on those areas where there is disagreement. And I think another an example of where there has been some bipartisan agreement and progress over the last few sessions has been a surprise medical bill. The legislature has in a very bipartisan way work to provide additional consumer protections in that regard. So that would be another example.
So the subject was raised of Medicaid expansion, so I guess I should jump on it, even though I'm told that there's no chance, at least in the current situation. So what would you say about Medicaid expansion?
Well, I would say, a lot of people talk about it. The vast majority of people in here, or there's many people that want Medicaid expansion, but they don't want to be on Medicaid. I think we can do better. I think one of my focus areas is trying to get healthcare costs down. And honestly, you would have money to be able to pay for other people who can't afford it if the cost of medical was down. And when I say cost of medicine, literally the cost of medicine in this country is we spend twice what the rest of the first world spends. Germany, Japan, obviously Germany's part of Europe, but Canada. Twice, regardless of who, and what we often argue about is who's going to pay it, but why is it, and by the way, for about the same results. I know on some high-end cancers we do better, but our from a life expectancy, all of those things, we're paying twice as much for the same results. Maybe we can all agree, and I'm pretty sure we can all agree, that maybe we shouldn't be doing that regardless of who's paying for it. We can argue about who's going to pay for it and how deep that cuts, or who all is going to be included on that. But I think all of us ought to agree that we need to make a more efficient medical system, that there's no reason for us to pay pharmaceuticals. How is it that we can pay literally twice what they're paying in Europe for the same thing? Literally the same thing. If we did that with cars or something, if you're paying $20,000 for a car over in Europe and $40,000 here, we would get to the bottom of it. And it's almost exclusively a political problem. And I think in Texas, we should be able to agree on it.
So
we may not agree on how to get there.
Yeah. Well, reducing healthcare costs is a huge issue.
It is.
And there are some things, I suppose, at the state level that can be done to address that. Where would you start?
Well, I think one of the things, because people, when we talk healthcare, they're talking about the Medicaid, and they forget that there's a huge population of people. There's 29 million people in Texas. If we can address healthcare costs, it helps all 29 million. Yeah. Medicaid expansion would make about 1.1 million people eligible, about 700,000 who would take it. Significant number of people, but if we can address healthcare costs, you have a huge swath of people who are paying for health insurance that cannot use it because of a $5,000 deductible. And it's because, but again, if healthcare costs even 25%, just a little bit less, they could afford, they'd have lower premiums and lower out-of-pocket. So there's a number of ways, and that's the challenge. I think sometimes when you get into medicine, it's a lot easier to just go, well, let the government pay it, as opposed to addressing the 10 or 12 things you need to do. And you really almost have to, you start with transparency. There is no way to have lower costs if nobody knows how much something costs. You walk in, you have no idea what it costs. In fact, I talked to one of the, you cannot walk into a medical service. It is very difficult to find out what something is going to cost. I'm told it's actually the law to get an estimate. Have you ever gotten an estimate when you go in for a procedure?
I haven't.
No. So it starts with transparency. And there's a bunch. Then do you have competition? Do you have, but that's where people lose it, because it's easier to just say, let's let the government pay for it.
Yeah. So, Representative Turner, what's your thoughts about price, cost?
So I will agree wholeheartedly with Chairman Frank that our goal should be to lower costs in healthcare overall, nationwide and here in Texas. I would submit strongly that Medicaid expansion is a key component in accomplishing that for a couple of different reasons. So one, talk about people's health care premiums. And absolutely, that health care premiums in general are too high. Estimates I've seen is that in Texas, 1/3 of our premium costs is basically going to subsidize the uninsured, to subsidize uncompensated care. Why do we have so much uncompensated care in Texas? Because we have the highest rate of uninsured in the entire nation, where still nearly 1 in 5 Texans does not have health insurance. So that drives up healthcare costs for everybody, including our health insurance premiums. More fundamentally than that even is, so how do we drive down healthcare costs? Well, what costs a lot in healthcare is when chronic conditions become unmanageable and become things that are less easy to manage because they've spiraled out of control. So I'm talking about chronic conditions like diabetes, like hypertension. Hypertension, if not managed the right way, can lead to serious heart disease problems down the road. That costs a lot of money. Not to mention, more importantly, it shortens the length of someone's life and reduces their quality of life. Reduces their productivity, and is heart disease is a leading cause of disability in this country. So if we can take someone who right now doesn't have health insurance and doesn't have a medical home because they can't afford to go see a primary care provider, and get them in a relationship with a primary care provider, say, you've got hypertension, we're going to prescribe this pill that's a few bucks a month to get your hypertension under control, and also work with you on things like diet, exercise, other lifestyle type factors then can we delay or even prevent the eventual onset of heart disease down the road? I think we can, and I think that's the one of the biggest challenges we face in Texas in healthcare, with so many people not having access to see a primary care provider and letting these chronic conditions become real healthcare emergencies. Not to mention the things that just come up. Someone breaks their arm, or has the flu, or gets a stomach bug, and either they don't get something treated, or it's an emergency because they get so sick or they're so injured, and then they end up in the hospital emergency department, which is the most expensive form of health care in the world. So I think Medicaid expansion, for lowering costs for those, or creating access for those 1 million or so Texans, is going to help lower costs overall, and more importantly, improve the quality of life and extend lives for a lot of those folks.
Many of the issues you raised are pharmaceutical, or can be treated with prescription drugs. Mm-hmm. And so the cost of prescription drugs is a big issue. Is there something that you all are working on to reduce the cost of prescription drugs?
Well, I'll admit that's not my area of expertise. I will say, I fully support what President Biden is trying to do with respect to allowing CMS to negotiate prescription drug prices. And I think that was a major oversight when Congress passed Medicare Part D back in the mid-2000s. And that has contributed to the high cost of prescription drugs in this country. I mean, the VA is able to negotiate those prices, and as a consequence, VA prescriptions are a lot less expensive than they are in the Medicare system. But I know there's a variety of issues too that we can look at the state level. But I think clearly, I hear from my constituents the need to lower costs for prescription drugs, and I think the federal government using their purchasing power to be able to do that would play an important role.
Representative Frank, on that issue.
Well, on the pharmaceutical, there's a lot of things we could do, and I think there's some Texas solutions. Dr. Oliverson and we passed a bill, it didn't get fully funded, to try to come up with a way for Texas to use our buying power to help, to particularly folks that are uninsured, to buy cost competitive drugs. Yeah. I do think we have to look at part of the challenge with talking about healthcare. It is a extremely complicated, in some cases, shell game between the way you actually buy things. With kickbacks, you essentially have insurance companies that own PBMs that are buying the drugs. We buy it from the insurance company, but not from the insurance companies, but based on their price. They then get paybacks. I think looking at, not paybacks, but kickbacks, looking at some transparency in those regards, I think is tremendously important, because essentially you're being told, or our employees are being told, well, hey, this is a $100 drug, and I'm like, but you bought it from them and then you got a $60 kickback. Mm-hmm. Was it a $100 drug or was it a $40 drug? Yeah. And that lack of transparency matters. I mean, that's, I've said this in other meetings, but when I'm looking at what my insurance company is paying, because we have our health plan, we have a health plan with about 160 employees, and they say, hey, we're spending $500,000 on drugs. And I say, is that before or after the rebates? Yeah. Well, of course, it's before the rebates. So they say they're spending $500,000, but they're probably spending significantly less. Those rebates are as much as 75%. And that lack of transparency, particularly if you have no insurance competition, means you're going to pay much, much, much more than you should. So I know that's why I'm saying it gets kind of complicated on that.
Yeah. Well, it is complicated. Healthcare is complicated.
It is a financial puzzle, and it's intentionally
right.
It is intentionally complicated. Honestly, I've said before, I don't think there may be some things that we can do. We can either say, hey, the government's going to pay, or there's some bills we can pass. But until some of the major providers change their mission or philosophy, it's going to be hard. Because honestly, when you have providers that are willing to charge Chairman Turner $200 for a service, and then somebody who's uninsured comes in and you're charging $800 for the same thing, if that happened in the private sector, we would anywhere but medical, right? If that happened in a convenience store, not much for $200 in a convenience store, and one person got charged $800 and somebody else got charged $200, we would go crazy. We would talk investigations. That's just standard practice.
Yeah.
And anyway.
Yeah. So we've got time for some questions. There are people that have microphones at the back. So if you would like to ask a question of either Representative Frank or Representative Turner, please raise your hand, and they'll bring a microphone to you. While they're doing that, what about priorities in the upcoming legislature?
Well, can I just make a comment
sure.
on the Medicaid? Because that
Sure.
ends up being a big deal.
Yeah.
If providers, when more people were insured, lowered their prices,
Yeah.
that would be correct, right? Because if part of the cost is uninsured, and then all of a sudden we start insuring them, then you would assume providers would drop the prices. That's just not happened. We've, in the last 20 years, gone from about 2 million Texans, I may be a little wrong on my dates, but about 2 million Texans insured by Medicaid to 5 million over only 20 years, which is far faster than the growth of the population. And has anybody seen any kind of, during that same 20 years, healthcare has expanded about had about 7% inflation every year. So while conceptually that is correct, I have not seen the healthcare costs come down in fact. So if there is ever a way to do it, it would certainly need to tie that we actually, if we're going to have a higher number of insured people, then are you going to lower your price? Because if you don't, all we did is just a windfall.
Yeah, I think one important clarifying point there, though, is, in Texas, if you're on Medicaid, you're most likely a kid. You're most likely a child. It's very difficult for, under eligibility requirements, for an adult to be under Medicaid.
And special needs.
Special needs and women who are expecting. But outside of that, there's, it's largely a program for children. And our state is booming in terms of young people. We have a lot of kids in our state, and that's driving that enrollment growth. There's no doubt. There's no doubt about that. But my point is on lowering overall costs, for adults who have chronic conditions, or just, maybe they're perfectly healthy but have, an illness or an injury that comes up. Having that medical home, being able to see a primary care provider, and being treated at that point where healthcare costs are lower as opposed to the emergency room is a key thing we can do to help lower costs.
Yeah. Okay, good. Who has the first question? It's hard for me to see out there. Where is?
Hi, I'm over here. I'm standing in the middle.
Okay.
Hi. Hi, I have a question for Representative Turner. My name is Julie. I'm a pharmacy student. I'm a fourth-year pharmacy student. And my question for you is, just hypothetically, with the expanded coverage of Medicare patients, like right now, we're going through a shortage of healthcare workers. Like with the increase in coverage and more patients coming in for visits and stuff like that, what kind of impact do you expect on the workforce?
And you're talking specifically with increase in Medicare patients, you said?
Medicaid.
Or Medicaid. Okay. Well, look, we haven't. Thank you for raising that because we haven't talked about workforce issues yet today, and that's a critically important piece of our economy overall, but as it relates to the healthcare industry in particular, because we know that we have a shortage of professionals in the healthcare industry, and it's going to be critically important that we get more students through higher education, both for undergraduate and then into whether it's medical school, nursing school, pharmaceutical school, such as yourself, and not to mention lab techs and a whole host of other professions in the healthcare industry to meet the demand in Texas, particularly as our population continues to grow, and it's going to continue to grow. And so one of the actually wins we didn't talk about from last session that I meant to mention, this was late in the third special session, but the legislature finally passed tuition revenue bonds, which is how we fund capital construction projects on our college campuses in Texas. And a lot of that is for general academic facilities, but a significant part of it is for healthcare institutions. So that means medical schools and other other healthcare institutions. And construction isn't the only piece of the puzzle, but that's an important part to funding or accommodating increased growth in terms of enrollment, increased research capability in those institutions, and being able to attract some of the best and brightest, both students and faculty, to our healthcare and general academic institutions around the state. But your point is well taken that the legislature needs to really focus in on workforce development in a variety of fields, particularly in healthcare.
You look like you might have had a comment.
No, actually, no, he was the perfect one. He's chair of the higher ed.
Used to be,
I'm sorry.
yeah.
Sorry.
Used to
So,
be.
yeah, he had the background on that, did a great answer. I'm good.
Okay. Who has the next question? Where's the microphone?
Over here. I wanted to ask, going back to your broadband expansion in Texas for paving and laying down the infrastructure for healthcare delivery via telehealth, e-health type of services. In this consensus-built broadband legislation, are you looking at treating not only the broadband as infrastructure, but for our consumers of healthcare? Will the devices be considered a covered device under Medicare, Medicaid, insurance payments? Because I know in the pandemic, in our healthcare system, we had so many elderly who didn't even have smartphones. They didn't have computers. They're completely trapped. They needed services. And then we had even group homes with our disabled populations where they had no internet in the house, so they've lived the whole pandemic in lockdown almost and then they didn't have devices. Even cellular, you would have to have a staff, a care staff, to do a telehealth session. So you said there was a lot of consensus around expanding broadband into the rural communities for services, but how are you going to lay down and reform? You're not even reforming, you're laying down the future of this new healthcare delivery ecosystem. What are you thinking there? What's the consensus?
Well, I think from a broadband standpoint, I think it is really much more understood. In fact, I've been in 9 years, I guess working on my 10th year, and my belief and understanding of broadband, it has become a utility. It has become, I would have said 10 years ago it wasn't a utility. Now it's not just healthcare, frankly, it's also education in rural areas. There's a lot of educational opportunities. I think she's over there, isn't she?
Yeah.
I can only see
It's
her.
right under the lights,
Yeah,
so
right
you
under
can't
the
see her.
light.
Yeah.
But it really, I think, it's more than just healthcare. I have not contemplated or thought about, honestly, the device side of things, although frankly, a smartphone costs a lot if you just need internet. I mean, you have the internet access, which we have put some of the infrastructure in place for. You can get a basic device for a pretty nominal amount. I don't know that we have looked at whether or not that's part of the Medicaid system. There's the first I've heard about it or thought about it, but I think that the biggest thing from a government standpoint, I think, is to make sure that the infrastructure is in place and make sure that the funding is in place, that broadband really is a utility, and I say loosely, connectivity. It doesn't have to be broadband, it could be satellite. It's just connectivity is now a utility. I think much like water and electricity and roads.
And I would just add, I completely agree with that. It is a necessity to have access to high-speed internet, whether again it's broadband or a different mode of delivery. But it's critically important that we increase connectivity in rural Texas because a lot of parts of our state don't have that connectivity. But it's also an issue in some very urban and even suburban areas in our state. I mean, I know I represent a very urban, suburban district in the Dallas-Fort Worth area in Arlington and Grand Prairie, and I have neighborhoods that for whatever reason people don't have access to high-speed internet. Not a lot, but there are some. And so whether it's for education, for applying for a job, for paying a utility bill, or accessing health care, all those, every Texan should have access to high-speed internet to be able to do all those things. And I think one of the positive things positive side effects, I guess, of the pandemic is I think people have gotten much more comfortable with a lot of things we can do virtually. the Zoom joke earlier, notwithstanding, but telemedicine, I think is a great example of that, where people got comfortable with virtual visits and were able to see a provider that way in a cost-effective and very efficient manner. But we don't want that to be available just to some Texans. We want all Texans to have ability to do that.
Yeah, and it's not just telehealth, but, there are heart monitors, and
Absolutely.
glucose monitors, and an increasing number of healthcare-related devices.
Yeah, some of the
Internet
long-term care, you can
things,
stay in your home
that
if
are
you have certain
dependent on-
devices, whereas you have to be in a nursing home without them. So,
Yeah, perfect.
Very important.
Another question.
Yes.
We are
So-
having trouble.
over there.
Someone over there, yeah.
Okay, Bill.
So thank you for being here. My question may come off naive because Medicaid is not my expertise. Yet I'm curious if you all think there could be bipartisan support to extend Medicaid for children. So I recognize that if a child is in maybe a middle-class household, they can be on their parents' insurance up until 26. And so it just seems kind of unfair for someone who's low income or experiencing poverty for that kind of coverage to just stop once they're considered an adult.
So, can I clarify before you pass off the mic off? Do you mean increase eligibility for certain children, or extend the length of time that they're covered?
So if I'm a child, I'm going to a federally qualified health center, I have coverage because of my parents have no income or very low income. I have Medicaid coverage. And so it doesn't have to be that my coverage has to end just because I'm adult, right? Because
extend the
Got it.
coverage from 18 to 26.
yes.
Got it. That's a great question.
Yeah.
That's a great question. So, well,
I know.
you know what I'm going to say?
Sure. Why not?
So I think you raise a great point, and I think that someone shouldn't lose their health insurance just because they turn 18, or more fundamentally, access to a doctor or the healthcare system. And so I think I go back to Medicaid expansion. I think that is one way to help address that gap, because it is a real gap. But you're right, it does create an inequity. If someone whose parents have health insurance, traditional health insurance, can stay on their policy, their parents' policy, until the age of 26, but their classmate turns 18 and is dropped because their parents don't have health insurance, that's not right, and that creates an inequity in our system that holds our state back.
Yeah, I think I would start with the ideal is that 18-year-old young man or young woman, if they can, are on their own. They are not on government assistance. That's the ideal. Now, if they can't, I truly do. It's funny, I think Chairman Turner knows me. I work in this area. It's important that we take care and that we have a safety net. But it is also important that we encourage people. We have to have people that are not wanting that, right? It is not, I don't think it is not healthy for the human condition to want somebody else to take care of us at all time. I think there's some real consequences of people being on health care in their parents' basement till they're 26. Sometimes is that necessary? Sure. And does it also create some dependence in some young men and some young women that aren't growing up? Yeah, it does. And so trying to find that balance, I think just doing a carte blanche, you know what, let's just do it for everybody, that makes sense. I don't know that that's really the ideal. I don't think most people want to be on that. But there are clearly some, and we can certainly talk about that.
Okay, I'm looking for the next question.
I stay over here.
Okay, there you are.
Right
All
here.
right.
Hi. Thank you all so much for coming. And this is something that I probably should have asked of all of our speakers today, but maybe was waiting for you all to answer. So we've talked a little bit about health equity and health disparities, but I think we're kind of glossing over what we really truly mean. We're not really talking about disparities in racial and ethnic minority groups, and then also members of Lgbtq community, undocumented immigrants, things like that. Especially in the state of Texas, I think it's imperative that we really try and bridge that divide, because we do have multiple cities. I'm from Houston, I'm from Legacy Community Health. We're one of the most culturally diverse cities in the country, honestly. And so we have a group of people that are really, really suffering. And sometimes that's because of the divide between Democrats and Republicans, because we don't always talk about really what we mean when it comes to social justice and equity. And sometimes when you say the word social anything, kind of is a misnomer for some people, and that kind of creates a little bit of a block. So I'm just curious as to what you all want to do as state legislators and people who do have political power within this state, as to really bridging that divide and bringing the conversation about social justice and social equity when it comes to racial and ethnic minorities and members of LGBTQ communities as well.
Well, thank you for that question, because the premise of your question, I think, is exactly right, and it's an issue that we need to be very open about and talk about more. And there is no question that when we talk about people who don't have access to health care in Texas, whether that's because of not being insured or for other access reasons, we are disproportionately talking about communities of color. There's no question about that. And so that's one of the things that I think that if we were to expand Medicaid and do other things to increase access to health care, it would disproportionately benefit communities of color and therefore the majority of our state. Our state is a majority minority state. So that's number one. Number two, I think that with respect to the LGBTQ community, this has obviously been in the news a lot lately, and with really the just shameful attacks, in my view, on transgender Texans, transgender children in particular, and their families. And what is happening with the Attorney General's opinion a couple of weeks ago, and the governor's subsequent directive to DFPS to go after these families, and that's what's happening. There's been a lot of news coverage about how some of these families have had knocks at the door from state of Texas employees, posing, demanding information about the health care treatment that their child is receiving. That creates a tremendously chilling effect. It is, I think, just antithetical to our values as Texans, as Americans, and recognizing A, people's freedom, and B, people's personal medical business and decisions. And I'm glad that a court has temporarily, at least preliminarily, put a halt to that, and it continues to work its way through the judicial system. But I think what's happening right now has no place in our state government.
Want to add to that, Representative?
Yeah, I would just add on the disproportionality, and the more we can do from an access standpoint, because I think it's kind of interesting that in our state we view everything about health care through the lens of a financial product that actually doesn't provide health care, right? We view everything as either an on-off switch. So a person who has insurance that can't access it because he or she has a $5,000 deductible, they're in the good side. A person who is in Medicaid that can't get an appointment is counted as good because they have Medicaid, right? That what we need to be focused on is actually access. And I think there are things, actually, federally qualified health community health centers are fabulous. The one in our area, there's a number of them around the state that do a fabulous job. They're not considered insurance. They're just providing the most important thing, which is primary health for folks. And so I think expanding that, we did some of those things during the interim with some more money going to those organizations. I think anything that we can do that actually focuses away from politics and on to actually accessing health care is good and will have a disproportionately positive impact on those areas. And I think it's something that we're looking at. Can we look at it better? Absolutely, but I think we need to focus on actually the things that have access, not focus on this one issue that may or may not even help with your access. That is also a political lightning rod. I know we can focus on it because we have done some of the other stuff.
That is a great spot, a great issue for us to kind of end on.